Welcome to your guide to nose reshaping. Take a few minutes to familiarize yourself with the procedure and what you need to do to help improve your results. Remember, this presentation does not take the place of your consultation, and you should make sure to jot down any questions you may want to ask us later. Nasal surgery, also known as rhinoplasty, is the second most common facial plastic surgery procedure, performed on more than 250,000 people a year. Because the nose is the most defining characteristic of the face, a slight alteration can greatly improve one's appearance. Many people seek nose surgery for a variety of reasons that include being unhappy with the nose they were born with, the way age has changed their nose, to improve breathing, or to change the way an injury has altered its appearance. Procedure: how will your rhinoplasty be performed? The two most common methods for performing rhinoplasty are the open technique and the closed technique. During closed rhinoplasty, all incisions are made within the nose with no visible scarring. After the incisions are made, the skin is lifted and the cartilage, bone, and tissue underneath is sculpted and reshaped to produce the desired result. In open rhinoplasty, an incision is made in the tissue that separates your nostrils. This allows the surgeon access to the tip of your nose and better views of the underlying tissue. To build up nasal tissue in African Americans, Hispanics, or Asians, implants, grafts, and/or cartilage can be used. The skin is then redraped over the newly shaped area and secured with very fine stitches. Once the procedure is complete, a splint may be placed to help your nose keep its new shape. Soft, absorbent packing may be used inside the nose to maintain stability and reduce post-operative bleeding. If you are having difficulty breathing through your nose because of a deviated septum, a septoplasty may be recommended and performed during your rhinoplasty. This surgery can also be performed as a standalone procedure. The goal of the surgery is to create unimpeded airflow through the nasal cavity. During a septoplasty, a small incision is made in the lining of the septum so that the underlying cartilage may be manipulated and straightened. Small splints and sutures may be placed inside the nose to support the straightened septum. Breathing issues may also result from an enlarged turbinate, and a turbinoplasty may be recommended. The turbinates are tissue structures located within the nasal passage that humidify and warm the air as you breathe. An enlarged turbinate is a common complication of a deviated septum. Turbinoplasty and septoplasty are often performed during the same surgical period. During a turbinoplasty, bone and/or soft tissue is removed from the turbinate to decrease the size. Temporary packing is used in place of sutures. The packing will dislodge on its own after a few days. Together, we will select the technique that will provide the best result for you. When you meet with our patient coordinator, we will discuss fees and costs. Preparation. Every person has a unique perspective on what may be the best shape for their nose, and your goals will affect the way your nasal surgery is performed. It is important to discuss your desires and listen closely during the consultation so that you can set realistic expectations. A great result can only be achieved when there is good communication between us. You also need to understand that the shape of your nose before surgery will partially determine the shape you have after surgery. Some suggestions to help you prepare for surgery. Your safety matters to us. You should be very open, provide your medical history, drug allergies, list any previous surgeries, medications, diet pills, vitamins, and herbs you are taking, even if you don't think they're important. Also, don't be afraid to be frank with us about your lifestyle, smoking, the strenuousness of the work you perform, your exercise habits, and the importance of getting back to work. Here are some other tips that will help you reduce scarring, shorten your recovery time, and decrease your chances of complications. Discontinue using aspirin, ibuprofen, naproxen, St. John's wort, and vitamin E for 1 week before and a few days after your procedure. These act as blood thinners and could cause problems with blood clotting. Stop smoking and drinking alcohol in excess well in advance of your nasal surgery and for 1 week after surgery. Drink lots of water in the days leading up to your rhinoplasty. Hydration will help you recover more quickly. To make your recovery easier and more comfortable, be sure to arrange for someone to take you home and take care of you for at least the first 24 hours. Fill your prescriptions prior to surgery and place them within easy reach of where you will be resting. Place plenty of pillows or a bed wedge nearby so that you can keep your head elevated. Recovery. You should plan on resting with your head elevated for the first day. During this time, you may have a headache and feel puffiness and pain around your nose. You should expect some bruising, swelling, and pain the first week or two. This can usually be reduced by cold compresses. You may also notice some bleeding for the first day or two. This will usually stop on its own. Any nasal packing you may have will be removed within a few days, while splints and surgical dressings are usually removed within 1 week. Stitches will come out or be absorbed on their own between 4 to 7 days. Numbness on the tip of your nose may last several months and is to be expected. Pain medication will be prescribed to control the discomfort. However, if you begin to have severe pain, contact us immediately. The recovery process is different for everyone, but within a day of your rhinoplasty procedure, you should be up and walking around. For the first week, you should plan on being out of work and away from your usual activities. Over the next couple of weeks, your face may be bruised, and you may want to consider using special camouflage makeup as you heal. For the next 2 or 3 weeks, your nose may be very sensitive and strenuous physical activities should be limited. After 2 weeks, air travel, exercise, and sex can be returned to gradually. You should avoid the sun or any physical contact to your nose for about 2 months. If you wear glasses, you will need to replace them with contacts or reposition them so that they are not in contact with your nose for about 6 weeks. Rhinoplasty is a permanent cosmetic procedure. However, your nose's appearance may change as you age. The appearance of your nose should improve over a period of up to 1 year after surgery. What are the risks of nose surgery? This information is not intended to frighten you, but to help you make an informed decision. No question or concern is silly or insignificant. We will be happy to discuss the full range of potential complications and answer any questions you might have regarding this procedure. Many thousands of nasal surgeries are successfully performed each year, and thankfully, serious complications occur infrequently. But they can occur. Complications can include, and are not limited to, rupture of small blood vessels on the surface of the nose, asymmetry, changes to the nasal airway that interfere with breathing, and perforation of the nasal septum, which, while extremely rare, may be uncorrectable. As with all medical procedures, be sure to choose your surgeon wisely. It is important to choose an experienced surgeon you can trust and develop a good rapport with, so you can openly discuss your concerns and particular needs throughout the process of consultation, surgery, and aftercare. Should you decide to move forward with your nasal surgery, a surgery date will be scheduled. Prior to surgery, you will be given complete preparation and recovery instructions. Remember to keep your follow-up visits, as we are here to help make this a wonderful experience for you. Feel free to review any part of this presentation you like, and be sure to take a look at our before and after gallery to get a better idea of the results you may achieve.